All right, so here's a quick little video about trying to address some knee issues. For the last couple of days, I've had some issues where bending my knee going down a stairs has kind of been really bothering it on the outside lateral edge. And so I'm just going to see if I can kind of correct that through some MAT stuff. So just kind of show you some gait pattern stuff here. Walking up the stairs is not really any issue. I can pretty easily do that. But heading back down the stairs, going down with the left foot, it's not really big problem. But as soon as I go down with the right foot, this outside edge right here on my knee really starts to hurt. You can't quite tell with my gait pattern, but right there, I can barely step down. So when my right leg goes down, my left knee bends. That's where this outer side of my knee really begins to hurt. So I'm going to use some MAT and see if there's a way to hopefully correct that. So one of the first things I'm going to do is just try and check and see what my ranges of motion look like when laying on my stomach to see if I have a hamstring issue to where maybe I can't bend this leg back as far. So one I can do is just standing to the side and just trying to pull my heel up and just trying to see how far back can I get it toward my hip. Right there I can kind of feel that pain right here on this lateral kind of front edge of my knee when I'm pulling that left foot back. Okay, if I do this on the other side, I'm noticing that this one seems to go a little bit higher. And overall, I don't have a ton of range of motion on either leg, but when I pull this one back, it does go higher, and it doesn't seem to bother my right knee in any way. But again, when I go this side, it just seems like can't quite get it up as high, and it's definitely not as easy. And then when I get to right about here, it definitely gives me some strain right here on this lateral edge of the knee. So what that seems to indicate is that maybe there's something, whether it's a glute, a hamstring, or even this little tiny muscle that crosses the back of the knee here, or maybe a calf muscle that might be shut down. So another way I might check this is just laying on my stomach on the floor and down in this position. I'm just going to lift this leg up, and that one seems to be working pretty good. So that's my right glute check. And this one, that one's pretty stuck. So I'm going to sit here and just kind of work on this for a little bit and see if I can engage that left glute just a little bit better, and hopefully get that leg to start lifting up just a little bit more. And as I'm doing this, I do feel a little bit of a strain on my left inner hamstring as I'm lifting this up and down. So I'm going to change it just a little bit, and when I really externally rotate it, now I can feel it better on my glute. So I'm not able to feel it as good when I go more vertical. It kind of puts more pressure on my hamstring, versus if I can kind of turn it slightly this way, then I can feel a little bit more glute action. So we definitely notice there's a little bit of glute shutdown on that left hip. The other thing we're going to check is just the knee bend again. So there's my right leg heading back, and this one definitely doesn't want to go as far back. It's giving me a little bit of that same pain in the knee, versus this one a little further back. This one definitely doesn't want to, and if you notice, my leg's really wanting to turn this way as I do that. So what I'm going to do in this position is I'm going to hook my other foot behind here. I'm going to try and pull my left foot into my right leg and contract my hamstring as I'm doing that. Now as I'm focusing on this, what I'm trying to do is eventually get my leg to go this way and pull out, versus the way it wants to go is this way. So I'm just very gently trying to ease it into that range of motion, but really trying to isolate and feel my hamstring doing that curl position. So each one of these I'm just holding for about 6 seconds. And I'm trying to do a total of about 6 sets of this isometric contraction. And all I'm doing is, again, just trying to activate the back side of the leg here, trying to engage those muscles so that they give me a little more support when I'm going down the stairs. And again, it's only when my right leg goes down and it's when my left leg is bent that it really seems to be bothering that lateral edge of the front part of my knee. So just do this a couple more times. And then the other thing that I'm going to work on here next is I'm actually going to do some palpation treatment. And that looks like it got just a little bit better, just in that backward knee bend. And in this leg raise, it looks like that got just a little bit better. It's still kind of straining a little bit on that inner hamstring. So the next action that I'm going to do is actually a little palpation. So there's a muscle that crosses behind your knee that goes right here from the lateral edge behind your knee over here to the front medial side of your knee. So I'm actually going to try and palpate that muscle. Again, this is using some of the MAT sequencing or events to try to get that muscle to engage. Well, there's a muscle back here called your popliteus, and this muscle helps to support the back of the knee, but it also can flex the knee. So in other words, it can pull your foot backward this way. And then the last one I'm going to palpate quickly is just the gastroc. So I'm going to go both the lateral and the medial heads on this one. And this one, even though it primarily helps kind of push your toe down like this, it can also help bend your knee since it crosses the knee joint. So I'm just again trying to palpate the attachment points of the gastroc, both the medial and lateral sides, because my idea is that I need some support in bending that knee, because again, going up the stairs doesn't seem to be much of an issue. It's going down the stairs when this leg bends that seems to really be the problem. So in just a minute, we'll check this out and see if that's any better going down the stairs with this leg after doing a couple of those little palpations and isometrics on this left side. All right, let's give it a shot. So again, going up the stairs never really was any issue, so going up doesn't seem to be any problem there. And again, it was this left knee out here was the area that was really hurting. And again, it wasn't when the left leg was going down, it was when the right leg was going down. So we'll see if that's any better. And actually, that's quite a bit better. I don't know if you could see that from the beginning of the video, but it's definitely limping and kind of lunging off to one side when my right leg was going down. And now I definitely feel like that's smoother and not as challenging to go down the steps. So there's a little knee diagnosis, and it definitely feels a lot better just walking around and bending my knee. Hopefully it'll hold and last for the rest of the day.